the last diagram that we looked at, which was the overview of the flow of the heart, there might have been, or maybe not, some things that you should have noticed. And this one is a little easier because it doesn't have all the other words in it, so I'll just go over the things I want you to look at. First of all, there are two what we call atrioventricular valves, or AV valves, and those are at from the atrium leading into the ventricle. Notice that the flow is this direction and that it opens this way, and then the pressure of the blood in here is going to close that. Same thing is true over here. So there's a left atrioventricular valve and a right atrioventricular valve. Then there are two semilunar valves. These are the ones that are at the top. Notice they are also built the same way. That is, as the blood flows out of there, pressure back would close the valve. All right, so just once the blood leaves, then it's not coming back. That's kind of how that works. Okay, so there's two basically, I'm going to talk about the cardiac cycle. The cardiac cycle is dependent on two things. One thing is systole, which is the contraction of the heart muscles, and diastole, which is the relaxation of the heart muscles. Okay, so if we look at this cycle here, what is happening here? Let me see if I can get it in better focus. Okay, that's not bad. All right, so what is happening here is, first of all, we'll just start over here, where both parts, that is the atrial and ventricular parts, are relaxed. So everything's relaxed and the blood is returning back from the body, so there's a little bit of pressure also returning back from the lungs. So things are just kind of flowing into the heart at this point. As it flows through the valves, there would be, it's basically would close back, so it's not going to move back in that direction. It's mostly just going to be this way. This valve, however, is closed, so it's not going anywhere. So basically the heart is filling. All right, and then what happens is the first part of the cycle is the atrial systolic. So systolic, remember, is contraction. So the atrium contracts, and when the atrium contracts, that drives the blood out of the atrium on the top here. So the atrium is going to lose its blood, and the ventricular systolic, so that's going to relax. So that blood is, basically able to just move where it needs to go. So as this is contracting, it's going to be starting to push out. And then what is happening is the ventricular systolic, so that part, this part down here, squeezes and it pushes all the blood everywhere out. So it's going to be pushing it out towards the lungs or out towards systemic circulation. All right. So the other thing is that it is controlled via some nerves. And there are some nerves that are going to different parts of the heart. And it starts up here with the sinoatrial node. And that's going to send a signal to these nodes right here. So basically, this is where the blood, of course, is entering in. So that's like saying, okay, let's start this. This is kind of like the pacemaker. And then that starts the actual signal for this part over here and this part over here to be able to contract. All right, so it's like signaling. It's basically kind of a delay. So in the diastolic, it would be, just starting to send this signal, and the systolic, it would be causing the heart to contract. So that's kind of what this is saying. All right. Then another thing to talk about is the blood vessels. Let's just talk about a couple other things. Okay, so if we can talk about how much blood is coming out of the heart. This is called cardiac output. It's basically the volume per minute, and it's the volume. They usually measure it from the left atrium. All right. So the output is going to depend on the heart rate, if you're resting or doing activity, and the stroke volume, which is like 1 cycle's output, which is, on the average about 5.25 liters per minute. The lub sound of your heart is the sound of the atrioventricular valves closing. Those are the top parts. And the dub sound is the sound of the semilunar valves closing. That's the, well, those are also on the top, but those are the from the ventricle going out. All right, so that's a couple of things. The other thing is we talked about in the general cycle the difference between the arteries, arterioles, and capillaries, and also venules, capillaries, venules, and veins, returning back. So the small things, of course, are capillaries. The largest vessels are the arteries. Arteries are leading away from the heart and generally have a lot of pressure on them. So they are generally fairly narrow, and there's a lot of muscle that is surrounding it, and connective tissue that's giving it some support, as well as the endothelium that is on the inside. So if you look at it in cross section, it's narrower. Now, the narrowness also contributes to the force of the blood coming out of there. In other words, it's got to be enough force so that it would be going systemically around your body. And then it's going to get smaller, the arterioles, and they have a little less muscle around them, and the capillaries, which of course are fairly thin because we're depending on diffusion from the capillaries into the cells to get materials in and out, nutrients and oxygen, etc. All right. And then on the way back, the venules and veins in general, they are just in general larger. So they're larger around. They are larger in the sense that they are also supported by a lot of muscles and valves. And these valves end up, as the blood moves through them, they're much like the heart, where pressure back is going to close those valves. So this is important, especially in the bottom part of your body. So let's just show you, for example, if I was looking at your leg or something like that, and I have the blood flowing back through a vein, what is happening is I use the muscles in my leg to constrict those veins and push the blood up, and then once it gets through the valve, it closes back down. So as we age, those valves get broken sometimes, or they don't work as well. And this is why a lot of times old people have congestion in their legs. That is, like swelling in their legs and so forth, because the blood isn't moving up the way that it's supposed to. Now, another thing to keep in mind is that as we go away from the heart, so this is kind of depicting artery, arterioles, capillaries, venules, veins, etc. So as we move away from the heart, of course, the pressure, in other words, the pressure that is over here is much higher, but it has to be high enough to push the blood all the way around, all right? So the pressure over here is going to be like, the vessels are smaller around, and that increases the pressure. And then as you're going back, there's less pressure, but this is basically allowing the blood to be pushed through. And notice that you have a smaller vessel than over here, certainly, that's allowing for pressure, but it's getting smaller and smaller. That's maintaining the pressure throughout until it gets to the cells, where you don't want a lot of pressure. You want to be able to have some exchange of materials, and then the flow back is just going to, the whole volume of everything is going to be pushing it through, not so much pressure per se. All right.